And that must be quite the challenge, trying to do crisis pregnancy centers in a country that obviously in the school systems doesn't embrace the alternative to abortion. How do you deal with that?
Well, actually, it's amazing. It's a challenge and it's a great joy at the same time, because in the midst of, what we would say are difficult circumstances, the pregnancy care center movement is growing leaps and bounds. And I think that's because we're locally based and it's people in their local community helping others and being part of something that provides free services, saves taxpayer dollars, increases maternal health, and helps women and children in their communities. And it's interesting that you should talk about school systems and how things are working, because we have had tremendous success with abstinence presentations in the public schools. And I think that there is, within our younger generation, just a real yearning for truth and for commitment and for loyalty and for all the good virtues, really. I mean, that's an old-fashioned word, but we have a generation that really was raised without hearing that word many times. And so for someone to come along and say, you are worth waiting for, you should be respected and honored, and you are valuable, and that is to be protected and cherished. That's a wonderful message that I think sometimes we think, oh, they'd never listen. They listen in droves.
Well, and as far as what I call the revolving door, the students come in to the nurse and the nurses hand out condoms, and then, of course, they're guaranteed to fail. And people don't understand they're 100% guaranteed to fail. It's just at what percentage they will fail. And then when they do fail, the revolving door is, now come on back to us, we have the abortion for you. They're not required to provide alternative education, are they?
No, they're not. And what we have the ability to do that so many health centers tell us they cannot do is build that relationship with the young woman or young man. She comes into our pregnancy center. She's afraid she might have a sexually transmitted disease, but she doesn't know. We can do testing for her, but more than just the testing process is the opportunity for us to build that relationship with her, to listen to what she's saying, and to help her make healthy lifestyle choices in the future. And that's a great benefit of what our pregnancy resources do. We provide the testing, the limited ultrasounds, all those great tools are there, but in addition, it's having that ability to build a relationship of trust with that young woman and help her for her future.
And how would the young girls in the schools find out more about what you do? And they need to reach out. They're in trouble. I mean, there's the 800 numbers and so on, but how can you reach to them? How do you reach them?
One way that we reach them several ways. Our pregnancy centers, the majority of which are located close to college campuses or other educational institutions, will reach out and build relationships with people on campus. The vast majority of women coming through our doors, our younger women in particular, are referrals from their friends. They've heard from a friend that this is a good place. They're nice people. They care about you. So once that starts happening in a community, many times that is the greatest form of advertising we can have. But additionally, our internet advertising is such an important part of reaching that group. Our Option Line website, optionline.org, when she types in abortion services, whatever might be on her mind, she can go right to our website and be connected to someone at our call center who can help her and connect her to her local pregnancy center. Because we know that the vast majority of the younger generation are looking online for their resources, for their information. It's how they make their decisions. So we are there when they need us.
That sounds great. And what's the website again?
The website is www.optionline.org.
Optionline.org. All right, for those of you watching this, there you go. You can help get this information out. There is an alternative. Abortion isn't the answer. As so many people often say, we talk about abortion as if, safe, legal, and rare are, messages that people are supposed to hear. We believe, let's save the life. There's no such thing as safe, legal, and rare. Save the life.
Abortion isn't good for the baby, obviously, nor is it ever necessary for a woman. There is help and hope for every woman who thinks abortion is her only option.
Great. Thank you, Melinda.
Thank you.